Hello, my name is Bob Stout. I'm 62 years old. I originally came to King's Hospital with a torn Achilles heel and saw Dr. Farid for the first time in January 2021. 10 years ago, I had a meniscus tear and had keyhole surgery. After that point, the amount of sports that I did reduced dramatically. Over the next 10 years, I was finding it more and more difficult to walk. Walking around shopping centres started to be painful. I was trying to play golf and struggling to play a full 18 holes. It became obvious that something needed to be done. And again, that's where I saw Dr. Farid. The advice generally was that whilst I'm only 62 and still reasonably fit, that it was better to actually do the operation now and not wait for another 3 or 4 years where I'd be older, less fit, and find it more difficult to overcome and get through the operation. When I realized that I needed some help with my Achilles tendon, I immediately thought of King's Hospital. I'm very much aware of the hospital in the UK and the quality associated with it, and that gave me the confidence to come straight to King's to have my issues sorted out. And that's when I was introduced to Dr. Farid. Because of my existing heart condition, we decided to let the Achilles heal naturally. So there was no operation. I ended up seeing Dr. Farid 6 months later, where he advised that I needed both knees, total knee replacement. And that is the operation that I've just recently been through. The operation was on the 29th of April. From my perspective, it was very successful. I was walking on the first day with the Zimmer frame. When I checked out of the hospital on day 3, I didn't need the frame. In the first week, I was averaging 2,000 steps a day. Weeks 2, 3, 4, and 5, I was averaging 4,500 steps a day. And now I'm above 5,000. And the most that I've done is 7,000. I've been extremely happy with how things have gone. Dr. Farid is a very personable and clearly capable doctor. I felt very confident. And I would recommend King's Hospital to anybody should they need a similar kind of thing doing.
My name is Dr. Farid Ghasemzadeh. I'm orthopedic surgeon with 22 years experience in this field. My practice mostly is bilateral knee joint replacement. I also do shoulder and knee arthroscopic surgeries and different types of fracture management. Bilateral knee joint replacement is always a challenge for a patient and for the surgeon. There are lots of benefits, including easier rehabilitation. But at the end, bilateral knee surgery will help the patient to suffer one time and to recover faster than 2-stage unilateral knee joint surgery. So we discussed about the possibility of bilateral knee joint replacement as the pathology was affecting both knee joints. We also had a detailed discussion about the risk and benefits of these surgeries. He acknowledged the risk and benefits of this surgery. We scheduled him for bilateral knee joint replacement. We went as it was planned. He stayed in the hospital for maximum 3 days, and he was able to walk next day after the surgery. Now it has been more than a month from operation, and he is walking like a normal person without any difficulty. He is the happiest man that I have seen after the surgery.